Daniel, what does empatica do?
So Empatica is a company founded to do sort of human data acquisition in real-world scenarios. So we're founded to quantify emotion, focused on stress analysis, the body's fight or flight response, as well as parasympathetic modeling.
Tell us about Embrace.
Sure. So the Embrace watch is a application where we can do modeling of the stress response as well as motion characteristics involved in a seizure. We built a system that can model the seizure in real time and activate a caregiver in the event that somebody who's having a seizure needs help in a home setting.
Would you have any information on incidents as to how many people have issues with that?
Sure. So globally, we're talking about 65 million people who have epilepsy, and a third of them are intractable. So that means that they can't manage their seizures with medication alone or surgery. So they'll still be susceptible to having a seizure that could have some negative impacts on lifestyle.
So how exactly does your product work?
So we're measuring a couple of different signals with this watch. The first is the skin conductance measurement. So this is measuring the body's sweat response, which is activated by the fight or flight mechanism. And it's also activated when the seizure has direct impact on the limbic structures in the brain, so the amygdala, hippocampus, that will cause a sweat response in the palm. And we see a very significant sweat response during seizure activity. In all of the generalized seizures, it's much greater than what you'd see in typical fight or flight or sleep, where we'd observe high levels of arousal during the day. The other sensor technology is just in motion characterization. So by combining motion from an accelerometer and a gyroscope, as well as the skin conductance, we can get a very accurate detection model that has a very low false alarm rate, and it's quite usable in real-world settings.
So in how many markets do you have your products in use?
So we've just got a large clinical trial going in the United States. We're pre-submission stage there now, so just selling a consumer product and then having people enrolled in a clinical trial. In Europe, we just got our CE medical certification, and we're starting to roll out to different markets in Europe over the course of the next few months.
So looking at Germany in specific, any ideas about that?
Yeah, so Germany, we're excited to enter the German market soon. We don't yet have any translations for the applications, but those are underway. And then we'll be rolling out to Germany soon after that. So this is the Embrace watch. We display the time with the hour illuminated in blue and the minute blinking in white. It has 5-minute resolution. The Embrace is constantly running the seizure detection algorithm on board. And when it detects a seizure, it will notify the patient with a vibration as well as a visual red alert. In the event that the seizure is detected, the application will activate a caregiver that's pre-designated in your phone book. This can be any number in the world, and they'll receive an automated call and an SMS alert if it's a mobile number. In the event that the detection is a false alarm, the user can suppress the alert as well and give us the notification that it's not an actual seizure. This happens occasionally during types of activities that seem similar to a seizure in terms of their both skin conductance changes as well as motion. So if you're on a sweaty bus bumping along the road, it could trip the false alarm. In this case, the user can double tap and then hold the button, and this will suppress the alert. The partner application is called the Mate, and the Mate is a semi-automated diary that provides both sleep and activity characterization. In the context of your day, you can add a missed seizure and annotate a seizure to provide us with additional information about what occurs during that time. Automatically detected seizures will show up in the same way.